The presentation that I made was a review of a case of a patient who had 11q deletion and had frontline treatment with FCR, was in a remission for about 4 years, had relapsed disease, and the discussion was really around how do we manage those patients with relapsed CLL, non-17p deletion, and particularly patients who had had prior FCR and had a long first remission. And so I reviewed our old data with retreatment with chemoimmunotherapy, retreatment with lenalidomide-based treatment, and sort of showed the outcomes for that, and that was in contrast to the outcomes that we have now with the newer treatments, BTK inhibitor, also with BCL2, small molecule inhibitor, and clearly the outcomes are much better with those treatments. The strategy, though, with those small molecule inhibitors is that patients will go on, particularly the BTK inhibitor, will go on treatment and will stay on treatment. They offer very good and durable disease control, but usually patients get a partial remission and have to stay on treatment. Not so much with the BCL2 small molecule inhibitor, where, for example, with the MURANO trial, patients are getting venetoclax for 2 years, 6 cycles of rituximab in that first 2 years, and then we'll be able to stop treatment at the end of 2 years with venetoclax. So there are a number of options now for salvage treatment, is the bottom line from this presentation, a number of options, and the outcomes are much better than they ever were for patients. So patients are living much, much longer with their disease and have a variety of options to manage their disease available to them in the salvage setting.